First this afternoon, COVID-19 is still rapidly spreading in Rhode Island. The Department of Health reporting nearly 3,700 new cases since Friday. Good afternoon. I'm Kim Kalunian.
I'm Mike Montecalvo. The state's average daily positivity rate is also climbing. It currently stands at 10.7%. The health department says 17 more people with COVID-19 have passed away. 422 people are currently in the hospital, with a couple of dozen in field hospitals. And there is this headline today. Rhode Island is now averaging the most daily cases per capita in the country. According to the CDC, Rhode Island reportedly is an average of nearly 1,200 daily cases over the last week. Now, when you break that number down, it's 110 cases per 100,000 people. 12 News reporter Brandon Truitt spoke with the Department of Health about this concerning trend. He joins us now live from Providence with what he's learned. Brandon?
Well, Mike, the state says they saw this coming, adding it's exactly why we are in this 2-week pause. And when you look at these numbers, the context is really just so important.
But right now, we're in a very difficult spot in our state, and we need everyone to help out and do their part.
One of the state's leading doctors with a reminder that we are all in this together.
Rhode Islanders, we live with each other. You know, we're the second most highest densely populated state in the United States.
It's just one of the reasons Dr. James McDonald says the state found itself here at the top of the list for the average number of daily cases per capita.
We saw this coming.
McDonald says Rhode Island is leading the nation in the number of daily tests per capita, and they're adding more to it. The number he's eyeing closely, though, hospitalizations. Rhode Island currently 20th there.
That's a number that really indicates how well the state's doing and how much disease is really hurting us in the state.
I'm very frustrated.
The national spotlight not sitting well with those we spoke with today.
The state's doing pretty much all it can. It's people.
I want to get the hell out of Dodge. I'd like to move to another country right now.
The state saying most of the cases are coming from inside the home. People leaving their household and going to another, picking up the virus along the way and bringing it back. The state is halfway through its 2-week pause, restricting some businesses, closing others until the end of the week.
This is not the forever state, the pause. In other words, this is just for now. And I think it's important just to have something to look forward to. I think we are going to be in a much better place come Memorial Day. I think we're going to be in a much better place for that. I think the pandemic could be behind us by then.
Of course, the question is what happens between now and then. Guys, we know that testing is increasing here. Both field hospitals have patients in them tonight. It is Rhode Island, in fact, in the middle of this pandemic, guys.
And Brandon, we've been hearing a lot about a potential surge from Thanksgiving. Is the state seeing that yet?
Well, Kim, the short answer is no. Dr. McDonald expects to see some of those results starting to show this week and next week as well, but he did give some insight as to what Christmas might look like.
It's going to be a simpler Christmas. It'll be full of less stress and less anxiety, by the way. Church will be virtual. There really aren't going to be neighbor parties or office Christmas parties. And sometimes simpler Christmas is better Christmas.
Interesting perspective there. Dr. McDonald, of course, is just recommending you avoid the anxiety of putting someone else at risk. Guys, they're just recommending that people will stay at home, again, for the rest of the year, guys.